This is an unbelievable resource, an email I just received this morning. It's from the Heartland Institute, Ben Domenech, Healthcare News, and they're basically talking about the situation up in Massachusetts. Let me read you something there. It is rare for voters of any state to declare definitive opposition to a national legislative policy in such stark terms, but Massachusetts, perhaps more than any other state, has experienced the downside of government-run health care. The goal of the state's Commonwealth Care Plan was to reduce health care costs dramatically while increasing the number of insured citizens. However, more than 200,000 Bay Staters remain uninsured today, and the insurance premiums have risen at an annual rate of 8 to 10%, double the national average. Do you hear that? Double the national average in Massachusetts. And as you know, they voted in this Scott Brown, who unfortunately was one of the ones who created this mess up there, him and Mitt Romney. So when you hear their names, but the fact of the matter is we have a little reprieve right now. And I'm sure that if they bribed Scott Brown with a super-duper plan and have the rest of us pay for it up in Massachusetts, he'd vote for that too. So I would suggest you look into the statistics on this mandatory health insurance. And like I said, there's a lady up in Massachusetts, Beverly Flaxington, Flaxington. Hear her tale of woe, where she has insurance, but it's not good enough insurance for the freaking state. Do you understand that? And that's the same here with the Obamacare. Essentially, people who bought into George Bush's medical saving accounts and high deductible health insurance plans, that's not good enough. You see, the insurance companies have been pushing this all along, and they want all of it. They don't want you to assume any risk. They want to manage all the money that's going through this mess. The whole abortion thing, the whole public option thing, that was all a big diversion to keep you people just like, oh, we can't do this, we got to do this, we can't do this. This was all about money, and it's all about control. And there's provisions in the Senate version that you cannot change. It's like set in stone forever, eons. So all future generations will not have a choice as to changing anything. Now you tell me what kind of law, what kind of people, what kind of minds would do something like this. But you just sit there and take it, and you don't write your letters to the editors, and you just say, oh, they know what's best for me. They know what's best for themselves. This is unbelievable. And our own senators, Senator Specter and Senator Casey, who voted for the Senate version, which basically condemns future generations on changing anything. Why not? Why have a government anymore? Just make permanent laws that you can't change, and that's it. You have a dictatorship. The whole point of democracy is that you can undo any of the damage these SOBs have been doing, and now we have these treaties which are trying to get us into that we can't get out. We have the internet. Apparently, Obama's giving away to the rest of the world control of it. And as you see in China, what they did with the internet, they had their little censorship, and they go after people. Anyhow, there's a whole bunch of great links here you might want to check out. And as you know, Virginia passed a bill similar to the one that Matt Baker has drawn up, which would stop the federal government from forcing the people of Virginia from buying mandatory health insurance. Now, Matt Baker of Pennsylvania is doing the same thing. His bill is House Bill 2053. I suggest if you have anything going on upstairs, that you look into this bill and you start writing letters of support and getting your state representative to have such a bill or support that bill and get a Senate version going. This is war. This is the Alamo. And in case you people don't understand what's going on, it's unbelievable. I got a letter from Senator Casey saying, of course we can force you to have mandatory health insurance. After all, we can already force mandatory vaccinations. Now you hear these right-wing groups talking about this, and everybody's, oh, they're just conspiracy people, and they're just militants and all that, and militia. The fact of the matter is, my U.S. Senator Robert Casey, said they can do that to you. That means that they can come in with some sort of crazy vaccine, and they can hold you down and hold down your kids, kicking and screaming, and they can inject you. And you don't know if this vaccine has been contaminated with any type of mad cow component. You don't know what's going on. They're talking about population control. What better way to control the population? You take the undesirables, you inject them with a mandatory vaccine, you create a thing like they did with the swine flu when Obama was trying to say, oh, this is a catastrophe. You go, oh, it's millions of people are dying. This is all BS. And I hope you open your eyes and realize that it's later than you think. And thank God there's people like Representative Matt Baker and other people. And, everybody's putting down Rush Limbaugh and Glenn Beck and Michael Savage and all these guys, John Gambling. Who do you think would be saying these things? Who do you think will be saying these things? Thank God they're still on the air. Because if they had their way, all these liberals who are for, rights and stuff, yeah, the rights unless you say something they don't like, and then they're going to shut you down. And that's a fact of life. Anyhow, folks, I've ranted enough today. I'm going to go down to the Red Rose, get some coffee, which is bad for me, but maybe I'll have some green tea now that I have a social conscience here. Take care. Bye.